Hello, everyone. My name is Rena Banerjee, and I am the Community Engagement Coordinator for the Arizona Commission for the Deaf and the Hard of Hearing, or ACDHH. We have a program called Community View, which is dedicated to spotlighting and celebrating individuals and places within our community to get that recognition that they deserve. So I would like to welcome Francis Altmaier. Hi, Fran. Thanks so much for joining us today. We are really looking forward to learning more about you and your role and how you serve our communities. So first things first, if you wouldn't mind introducing yourself and just telling everyone a little bit about yourself and your background, I think that's a great way to start.
Great. Thank you so much for inviting me. My name is Fran Altmaier, and I oversee our newborn screening follow-up program here at the Department of Health Services. Our program is responsible for providing follow-up for any out-of-range test results for babies who receive a newborn screening in Arizona. We screen for every baby is screened for 35 different conditions that are detectable at birth, and hearing differences is one of those conditions. My background is I'm a pediatric social worker. I have been with the newborn screening program for almost 12 years. And prior to that, I spent 18 years at the Arizona Early Intervention Program as a service coordinator and supervisor for Part C programs for babies birth to 3 with developmental delays. So I'm super excited to share with you more about what the newborn screening program does and how we're partnering with the Commission for the Deaf and Hard of Hearing.
Wonderful. Thank you so much for sharing. Yeah, if you wouldn't mind, tell me a little bit about your role and what the goals are for the CDC EHDI grant for the state of Arizona. How does your role help support and achieve those goals?
Absolutely. And it's actually a HRSA, not a CDC grant. So our program project that we're working with the commission on is funded by HRSA, the Health Resources and Services Administration. And the focus of that program is really to improve the 136 benchmarks that we consider part of the EHDI, or Early Hearing Detection and Intervention System. And those goals are every baby should receive a hearing screening before 1 month of age. And for those babies who do not pass that hearing screening, should have a diagnostic evaluation completed before they're 3 months of age. And for those babies that are identified with having different levels of hearing, we would like to ensure that they receive early intervention services before 6 months of age. So in the EHDI world, you hear a lot of the 136 benchmarks. And so again, that's screening by 1 month, diagnosis by 3 months, and enrollment in early intervention services by 6 months of age. So in addition, this project that we're working on will focus a lot on language acquisition. There's a lot of work to do to ensure that all the work of the 136 is actually resulting in improved language acquisition for newborns identified with different levels of hearing. So regardless of the modality or modalities a family chooses for their baby, the goal is really to ensure that they have access to language so that they can meet their developmental milestones.
Wonderful. Now, how do you make sure that both healthcare providers and parents can come together and have awareness of what happens after that newborn hearing screening?
Absolutely. So all babies who are born in a hospital receive a screening before they go home. Arizona has been really good about maintaining a greater than 98% screening rate for all babies in Arizona. So the newborn screening program also has a loan program. We have over a dozen pieces of OAE screening equipment to screen babies who are not born in a hospital setting to ensure that they are able to have timely diagnosis as well. For any baby who does not pass their newborn hearing screening, and that's the 1 month benchmark, we want to make sure that they get into diagnostic audiology for an evaluation before they're 3 months of age. So the newborn screening program has a team of follow-up specialists that will reach out to the families and to their pediatricians to coordinate that care and ensure that their babies are seen timely by a pediatric audiologist for diagnosis. We also have a data sharing agreement with our Part C early intervention program to make sure that those babies that are identified with a hearing difference are enrolled in an early intervention program by 6 months of age. So we've worked really hard to have an electronic message back and forth between our data systems so that we can see that these children are enrolled. And then we have a mechanism to follow up and make sure that those kiddos who don't get an appropriate referral are referred so that they can receive those services. In addition, our newborn screening program is dedicated to making sure that families have support along the way. So when a baby is identified with a difference in their hearing, we make sure that they are referred to family support. And this is where the project with the Commission for the Deaf and Hard of Hearing is really going to make improvements in the services and family supports that we're able to provide for newly identified families.
Wonderful. Really looking forward to that as well. Can you tell us a little more about maybe a particular case that the different organizations working together, bringing teamwork together, resulted in a successful situation for a child and their family?
Sure. So we daily, our follow-up team will reach out to families and talk to them. A lot of times a family, their baby didn't pass their hearing screening. They may not have been given all the information on what that next step is. And so our follow-up team will reach out to the families who may be waiting for a phone call to schedule something and not realize that they need to be the ones to schedule that. So we make sure the pediatrician is aware and that the family knows what that next step is to get that evaluation scheduled and coordinated. So we really are just that piece in the puzzle for the family to make sure that they know what needs to happen and are able to get that coordinated.
Okay, thank you for sharing that.
Mm-hmm.
And now I'm wondering if you wouldn't mind sharing your favorite quote or maybe some advice that really shows the impact that it's had on your life, or maybe even on the approach that you have to serving your community.
Sure. So that's a tough one. I mean, I think there's so many reasons why we all do the things we do. My personal belief is that just really help where you can. Partner. If you don't know the answer, partner with people to help you get where you need to go. And I think, my thing is I always say that if I've been able to help a person today, then it's been a really good day. I want to ensure that I'm able to support people wherever they're at in achieving what they need.
Wonderful. One other question that just came to mind. You had said that when a baby is born, they typically get that screening in the hospital. Now, I understand that more and more babies are being born at home. So how does your program address that trend?
Absolutely. So we provide, we have over a dozen pieces of loaned screening equipment to midwives out throughout the state to provide hearing screenings to the out-of-hospital birth community. We've located these pieces of equipment in rural areas, in metro areas, and the loaner agreement we have with these midwives is that we provide the screening equipment free of charge. We pay for the annual calibration and all the disposables they need. And in turn, we ask them to screen not only their patients, but anybody in the community that is in need of a hearing screening for their newborn. And it's been a very successful practice.
That's incredible. Wow, that's amazing. Well, thank you. Thank you so much for sharing all of this information. It is really valuable for our communities, as you well know. We here at ACDHH really appreciate your time, and we will continue watching to see the new collaborations between your department and the Arizona Commission for the Deaf and Hard of Hearing.
We're super excited. Thank you so much.
You as well. Thanks so much.
Thanks.